Hello, this is Tammy Brewer with Care Patrol. Wanted to talk with you today a little bit about in-home care versus home health. This topic can be a little bit confusing, especially as to who pays for it. So one of the ways that I got it straight in my head and I share with clients is think of this as the difference between a prescription and an over-the-counter medication. Most of our insurance doesn't pay for over-the-counter medication. So home health is medical care paid for by your insurance, ordered by your physician. That typically is a nurse to come do wound care or check vitals, physical therapy to come in and continue physical therapy or speech therapy, occupational therapy, other therapies that are medical. So our insurance covers that. Typically the aide or the therapist or the nurse, they're going to come in 3 times a week, especially with therapy. They may send an aide to help with bathing, but primarily they're there for the medical side of care. So not something that you could have the person come in the house and stay for 4 or 5 hours with your mom or dad. In-home care, a little bit different. In-home care is non-medical in nature and therefore not paid for by your insurance. So with in-home care, they are there to handle custodial care, things like bathing, dressing, grooming, housekeeping, light housekeeping, grocery shopping, meal prep, managing medications, and none of those services are medical in nature. They're all things to get us through the day. They are only private pay. Most companies do require a 4-hour per visit minimum, so it's important when you're working on your budget to keep that in mind. Average cost in Metro Atlanta is about $22 to $26 an hour, and that price goes down for the longer engagements. With some advantage programs, you can actually have that covered. It just depends on your coverage. Want to check that. I do typically recommend hiring companies as opposed to an individual. You may know someone from church or down the road who used to take care of a loved one. One of the reasons I look at companies is we know that they are licensed, they are bonded, insured. There's ongoing training for their staff in different types of care for different types of individuals. You also can run into issues with being an employer if you're hiring a private duty caregiver. Not only an employer, but if you had them move in with you, you could actually also be a landlord. If that caregiver should be injured in your home, you might run into issues with lawsuits or claims to your homeowner's insurance policy. So just some things to keep in mind when you're looking at hiring an in-home caregiver or an in-home company versus what is going to be paid for by your insurance with home health. Thank you very much.